I'm here on behalf of Generation PEP. We are a non-profit organization. We were initiated by the Swedish Crown Princess in 2016. Generation PEP was founded to change the trend that we see in Sweden, both in regards to sedentary behavior and the decline in physical activity. We try to be a collaboration platform for both businesses, organizations, and decision makers. And we try to work with all parts of society, trying to create initiatives and tools to give children a better health. We partner with established scientists and KI, GH, Folkhälsomyndigheten, and other parties in order to make sure that all of the initiatives we do are fact-based, and we also try to strive and spread knowledge around children's health. So our vision is that all children in Sweden should have the ability and desire to live an active and healthy life. We put a strong emphasis on all because we know that health is very unequal today and that health should be equal. And I think as an earlier speaker today talked about, it shouldn't be due to where or by whom the child is born that should determine the health. We can try to erase those inequalities the best we can in society. So what we try to do is really be that collaboration platform and make sure that society is investing in children's health in the best way.
Thank you very much. That's a really nice overview. But would you also like to describe a little bit about the problem, about the need that you want to be addressed within the scope of this hackathon?
Yes. So, I mean, what's been calculated today is that about 6,000 people pass away earlier than they need due to the result of their lifestyle. And we also know that that costs about 70 billion kronor each year in Sweden. And now these numbers of deaths and billions, it's not correlated to the actual corona pandemic that is going on today that we have so much figure and data about. But this is the pandemic that's been going on for several years, but it's very silent. It's no one investing in it. It's no one showing the numbers for it. And that's really why we need your help. We think that we need more transparent data on health and preferably children's health, because if we can keep track of health numbers in a better way, we think that we can make better decisions in how to make investments and decisions of where to put our money for children's health. So for an example, now during the pandemic, we have in Sweden accurate data on a day-to-day basis of how many are infected, how many are in intensive care, and how many lives are lost. And we can do that down to postcode, I think, in Sweden. And that's the sort of data we also need for health in order to be able to direct our investments into the right area and pinpoint where we need to put our focus. So to try to sort of scope the problem, I think in order to make the right decisions, we need data. And we need that data to support or reject our hypothesis about what to do and where to focus. And I think it's easier also to get the local organizations to act if we can show the numbers of the problems in that specific area where they work. And I think we can learn a lot about how we use data now during the corona pandemic. So that's basically the problem or the need that we see. We think that data can be a big sort of help us to get better decisions, but also more focus on the problems we're facing.
Yes, it's really about like utilizing data to be able to make informed decisions, but also to steer the attention into the areas that are where they are really needed of sort.
Yeah.
Is the issue that, you know, the data exists at different levels, or is it that there isn't any data at all of certain areas? What is the main issue?
Yeah. So we know Sweden is fantastic of keeping data. I know we have measures of children's weight almost from conception all throughout school. But that data is kept in different sources. But a lot of data, I should say, is available through systems like Statistiska centralbyrån, Folkhälsomyndigheten, Socialstyrelsen, SKR's Collada, etc. But some points are not available. And one of those points is, of course, the weight of all children, because that's on a regional basis. So we have all the numbers. I mean, it's registered all through pregnancy throughout school, as I said. So the data is there, but we can't, it's not publicly available to collect it on a national basis.
It is a little bit about like utilizing data from different sources, but also to be able to access it, to utilize it for another purpose than might be the point from the beginning. Mm.
Right. So I think, even though I hope that the data of children's weight will become available at one point, but of course it's a lot around integrity issues, I guess, because I mean the data is there, and it's also a problem about how to aggregate it, I guess. But there's a lot of other data points that could still be used in order to create a good sort of data model, or whatever you want to call it. And we're talking both about sort of output variables like children's weight, but also the input variables like how many parks, recreational areas, bicycle roads, etc. A lot of that data is publicly available. And if we can put that together to actually show the differences between different areas, cities, municipalities, I think that will give them a lot of data in order to sort of look through, okay, should we try to change the environment around these kids, or what can we do to better promote kids' health in our area?
Would that be the desired outcome of sort? That you want to be able to do analysis of different levels, or what would be the desired outcome of a solution to this issue?
So I think, I mean, the need really is to find some sort of, create some sort of model that could illustrate the differences between children's health depending on where they grow up. And I think the desired outcome from that would be that decision makers would use this model in order to direct their focus or initiatives into the right area, so that we have better decision making for the health of children.
Great. We got two questions in the chat. One is, could it be a simulator that is the end result of this?
Absolutely. I mean, if we can, based on a model with input variables, make simulations or forecasts, I mean, that would be fantastic. If we get hold of a lot of data, we could, I mean, track the development and see timelines. So it wouldn't be, I don't think it could be sort of impossible, but it will be tricky, and it will have to be based on certain sort of hypothesis around what depends on what, but I mean, that would be fantastic.
Another question is, what parameters would you need? Is it weight, activity level, anything else that you can think of? You already mentioned some.
So I think it depends on the scope here, and how big of a focus you want. But we know that there have been very many parameters that affect the children's health, and we've mentioned some of them. I mean, socioeconomics and educational levels, etc. So I think since we already have that data, it's in Collada, it's available. I think, I mean, mapping as many of the input variables as possible and putting them into the model would be preferably. But I also see it's a complexity of the model. But I mean, the more since the data is there, it shouldn't be, it's about creating the right algorithms around it. But I think the important part here is to be very transparent of how they interact with each other, because we know also that if you would try to see the differences between a big city and a rural area, of course, many parks or things like that would have a totally different outcome. So you would also need to find a model that doesn't just put out a number, but also you can sort of interpret what makes the numbers different in a city from a rural area, etc. So that it's also a tool for sort of further analysis for the people using it.
Yeah, so transparency is really a key word here. Yeah.
Yeah.
Thank you. Anders,
not a black box.
No, not a black box, but transparency throughout the whole thing. So you can actually also change things further on. So you can change it. Yeah, that's great. Anders, you have a question.
Yes. Thank you, Elin, for a very nice presentation and a good pinpointing of the need. I was a bit curious about the end usage of the solution that you are looking for. Who is the end user of the solution?
So yeah, so the first person I have sort of in mind is really if you look on a municipal level, you have the Folkhälsostrateger, for example, who tried to make sure that the municipality will want to make investments into children's health. And they basically don't have any data or any sort of calculations showing the numbers they need to get their numbers into the budget. And then, so when the decision is made on the kommunstyrelse, it's really about, finding where you get most bang for the buck. And those preventive actions tend to not get prioritized because they can't put the arguments forward of why this is important. So if we can give them a model where they can sort of simulate good data and very bluntly show how children in their area actually sort of perform according to health. I mean, are we ranking very low or very high in our community on weight and whatever other areas we want to put in there? Then it's quite easy, I think, to actually get some decisions makers to vote for investing in children.
Thanks. That's a good answer. Thank you.
Thank you. We have yet another questions in the chat asking whether there are any initiatives that Generation PEP is involved in that is focusing on digital solutions for children's activity, barnträning in Swedish. There seem to be a lot of different apps for grown-ups, but what about children?
Yes, so there are several initiatives and companies doing different online training programs. Is that what you're asking about?
Yeah, but specifically for children. If they have any own community of sort.
5 companies that, but we don't have our own program, but there are many programs out there, absolutely.
Mm-hmm. Thank you. Any other questions? No. Okay. Is there anything that you would like to add?
No, but I think, I mean, if I say, but if you can help us create a good sort of data model, I think that we can absolutely change the health for a lot of kids and the coming generations in Sweden, because I think this is one of the key areas in order to get the right decisions made out there all around our country.
So this is important in order to be able to actually implement the change in the longer run and get really focus on a societal level of this one. Yeah.